Yep. Yours is not.
Okay, that's all right. I can plug it out like that. But it's all right.
Thanks. Are you ready?
That's the good one.
All right, guys. Well, thank you for having me. My name is Amanda. I own New Beginnings Imaging, which is a mobile ultrasound service. I've been in business, it'll be 3 years this summer. Up until January, I've been mainly focusing on pregnancy ultrasound, but starting in January, I've been trying to focus more on breast ultrasound and just diagnostic ultrasound. And by diagnostic ultrasound, I mean your abdominal ultrasound, your thyroid, your vascular stuff. So basically, anything that I have the correct transducer to do for my machine, I can do an ultrasound on. Okay. So I put this beautiful PowerPoint together, and I think because of my fantastic little adapter, the resolution is really kind of poor. So what we can do, if you guys want to see or have questions on these images, feel free to come over to me and I can show you more of these in detail, because that's why I put this together, because ultrasound obviously is imaging, and what's the best way to explain this than with pictures, right? Okay, so today I'm going over breast ultrasound and what women should know. So here's a little bit about me again. Okay, so I've been an registered ultrasound tech for over 25 years. And these are all the different registries I have. I'm registered in breast, abdomen, OBGYN, and vascular ultrasound. So for today's discussion, we are going to go over what breast ultrasound is, normal breast anatomy ultrasound versus mammography, who may benefit from a breast ultrasound, and what to watch for. Okay, so what is ultrasound? Ultrasound uses high frequency, breast ultrasound uses high frequency sound waves to image breast tissue. Now, of course, there's other different types of ultrasound, like I just mentioned, we do abdomen, OB work. Those use lower frequency ultrasound because lower frequency penetrates best in deeper tissue. So when you do an abdomen or an OB, there's more depth here, so you need a lower frequency. Breast ultrasound, since it's more superficial structure, we need a higher frequency. So this is a small parts ultrasound probe. This does a high frequency. So it is a 15 to 4 megahertz probe. So what we do with this, or why it's a high frequency, is because we're doing superficial structures. But notice this one looks different than like your OB pregnancy ultrasound probe, right? This one is that linear surface. That's because when we're looking at a superficial structure, we need a flat surface to better image. Okay, so that's what that looks like. Okay, so what are reasons that breast ultrasound is done? There are actually quite a few different reasons. The most common one that we do them for would be for an abnormal mammogram, right? So when we go in, have our mammogram done, our screening mammogram, once in a while, sometimes for some people, it's more often than others, where you're told you need to come back for spot magnification views, or they'll call it additional views, and an ultrasound. So today you're going to learn why that is, right? So for an abnormal mammogram, what happens is if they do the screening and they're seeing something on that mammogram, if it's big enough to look for, to see on an ultrasound, or they're just not sure if there's really something there or not, they're going to order the spot magnification views and the ultrasound. What the spot magnification views are is where you're going to go back in for mammogram again, and they're going to use a much smaller paddle, and they're going to magnify that area of what they were seeing on that prior mammogram. Then the ultrasound's job is, one, is there something there to begin? That, of course, is question one. If there is something there, is it cystic, solid, And then they can kind of go from there. Now I'm gonna explain more of that as we go, okay? Other reasons we do ultrasound is for a palpable lump. Now, depending on your age, they may or may not do a mammogram. Typically under the age 40, sometimes even 35, depending on the facility, they may start with an ultrasound. Depending on what the ultrasound shows, they may do a mammogram. That's the radiologist's job to know which is important or which one to do when, okay? But if you're over the age of 40 and you're having mammograms, if you come in with a palpable lump, you're guaranteed to have a mammogram done and an ultrasound. Then other reasons to have an ultrasound done are dense breast tissue, because that dense breast tissue, masses and stuff can hide behind that. So if the radiologist isn't sure if there's anything hiding behind that, they will order a breast ultrasound. Pain, we frequently do breast ultrasound for pain and for nipple discharge. There are certain things in the ducts that can cause discharge, some that are benign, meaning not cancerous, and some that are cancerous. So it's very important to have a mammogram and an ultrasound done if you're having an abnormal discharge. Okay. And then patients that are at high risk for breast cancer, whether or not there's, you know, personal history, a first degree relative, or somebody with like a positive BRCA gene. And then implant assessment. We can look at implants and detect if they are ruptured. Okay, so the difference between ultrasound and mammography. So ultrasound does not use radiation. Mammography uses low dose radiation. No compression for ultrasound and compression with mammography. Real-time imaging with ultrasound. So that advantage, what that means is, one, we do take still pictures, meaning I get to where I'm at, I want to take a picture, I freeze it, I print, I unfreeze my image. The other thing I can do is literally take video clips of what I'm looking at, and the radiologist can look at the video clips. The other thing they can do is come in and watch me while I'm scanning, because if they're still not sure something looks real or they just want to look at it themselves, they'll come in and watch behind us and see what we're looking at. So that's that real-time imaging. Mammography is much better at detecting calcifications. Ultrasound does not. So that's the important piece with mammograms for calcifications. So ultrasound has a better detailed at soft tissue imaging. And then mammography provides a nice global overall view of the breast tissue. And again, that I'll explain a little bit more. I have a really good picture showing that. Ultrasound is more comfortable and gentle. Mammogram, we're just going to put it to standard screening tool instead of, we know it's not. Okay. Okay, so here's a normal blurry image of breast ultrasound tissue. Okay. So of course, at the very top, that is the skin surface, that thin white line there. And then this next between those brackets, that's glandular tissue, AKA fat tissue. Some of us have more of that or less than that, just depends on the person. And then this area right here is the pec muscle. And then down here is the rib. Now, let's say if we had more depth on this image, if I had the probe just right, you actually get a whole bunch of shadowing behind that rib. Okay, so what do we all see on an ultrasound, right? Well, these are not too bad. Just make it out what I'm going to explain. So that's awesome. All right. So there's certain things that we look at. One, of course, is going to be shape. Notice how circular that one is. Oval. That one is wider than tall. And look at this one. The shape is very irregular and jagged. So with that, we also look at borders. Notice how on that one, the borders are nice and smooth. Same with there. These are not smooth. Very irregular. So these are what we would call, they're going to look spiculated on a mammogram. Okay, and I'll explain that. Then we look at, you know, before I mentioned, we need to know if something is cystic or solid. So we want to look at the internal appearance of it. So if we look at that image, notice how that one is black or anechoic. This is solid and not black. And look at these. These are like just plain it, right? So that image is a cyst. Cysts are benign. We don't care about them. Don't worry about them. They're there. They come, they go. The only time we would care about them, sometimes they get inflamed and they hurt. Patient's really having a lot of pain. They'll go in, put a needle, take out the fluid. Sometimes it can come back, sometimes it's done, or sometimes they pop up somewhere else. That's just like the unfortunate part of having cysts. Then this one is what's called a fibroadenoma. This is solid, but it has nice smooth borders, but it's not black inside. So that one has more benign features to it. Now, when we come to this one, look at how complex it is. It's very dark here and brighter here. And then back here, it's very shadowy. These are all like, I can look at this and we all know this is cancer. We don't need to even, I mean, we have to do a biopsy to prove it. And then it will tell them what kind of cancer and all that kind of fun stuff. But when we see this on an ultrasound, I know this is cancer. And so we also look at these posterior features and it being shadowy. Look at the cyst. See how it's right behind there? That's called posterior enhancement. That is also a good sign that something is benign. Fibroadenomas typically have that. So that too will give us a sign that that is more benign. And you can see it. It goes from right here, there's a line, to about here, there's a line where it's brighter underneath that one. Let's see it. And then we can also see blood flow on ultrasound. Blood flow on, or ultrasound is one of the few modalities that does show blood flow. So this lesion right here is a cancer and it's showing us blood flow in there. So that's another sign to the radiologist that this is worrisome, and that's going to still push them in that direction. This has to be biopsy, and it's a known cancer until proven otherwise. And then it's important for us to know the size and location of a lesion. Let's see. Oh, I don't have it on this picture. But when we do a breast ultrasound, we actually treat the breast as a clock. And so that's how we know, like if you have an ultrasound today and we need to follow something up in 3 months from now, I actually will put right breast, and then I put 2 o'clock, 4 centimeters from the nipple, radial versus anti-radial. And that's all. So I know where I'm going next time to go follow that up. So that's there as a guide for all of us to be able to follow up those lesions and to make sure we're following up that same area, whatever it is. Okay. I just went over that. We're going to skip this one. Okay. And now what do we see with mammography? A lot of similar things, but yet different. So we want to see, of course, if there's a mass or there's any asymmetry between the sides of breast tissue. And my next slide will show you a brief, like an overview of what the radiologists look at when they're looking for asymmetry. But it's still one of these things that we see. Now, when you look at these pictures here, I chose all ones with obvious lesions. And so they're looking for these things that stand out, you know, because like that is not going to be on the exact same other side, the other breast, I should say. So they're going to know that right away there's asymmetry there and that there's something there. Okay. We also look at the margins of something, margins or borders. Notice how this one looks what we call lobulated because it goes like this and then like that. So that's lobulated. This one is actually very ill-defined because it doesn't have great distinct borders. It all kind of blends in, but yet when you get close to it, you can kind of see these finger-like projections coming out where it looks spiculated. So that would need to be followed up with those spot magnification views and an ultrasound because they're going to want to know, is there really something there? Or is that just where the image is distorted? Or is it overlapping tissue? So they're going to look into that more. Then we also want to know if something has calcifications. And that slide I did, okay, here, I'm going to go back that one in. So calcifications are what's very, very important to find on a mammogram. Sometimes they can be kind of scattered, sometimes they're bigger. Those are typically benign, but when they're in a pattern, like that would be along a duct, that is the earliest signs of ductal breast cancer, so invasive ductal carcinoma. So that is the goal of the mammogram, is detecting that breast cancer early. And the best way to do that is by looking for those calcifications in a ductal pattern. So then the next thing we look at is density of a lesion, or like the tissue composition. So notice how these are bright. So this is a high density. That would be high density. That's a little bit lower. It's kind of like some of it's brighter and some of it's darker. So it might even be mixed density. And this one is dark. So this has a low density. This is actually what's called an oil cyst, which means it's containing fat. I don't know how that makes sense, but that's what they call it. Okay. And then they look at architectural distortion. And that's this one up here where it just kind of looks, it just doesn't look normal. You know, it just is distorted, and they need to get more clarification on that. And so they look at that and they compare both sides for the mammogram. And then size and location. Forgot about that one. I was going to advance the slide. So size and location. So same thing with mammography as ultrasound. When they're reading that report, they're going to tell us that, like, they'll put in the report that this lesion is at 3 o'clock and in the right breast, or they'll say upper outer lateral. And they will guide us on where these lesions are at. So if we get them for ultrasound, we know more where to target. The other interesting fact about size and location is more commonly breast cancer is in the upper outer quadrant of the breast. More common. Doesn't mean it has to be, definitely can be anywhere, but that's where it is more common to know. Okay, so here's that mammogram overview images of what they look at. So when you see a radiologist reading a mammogram, this is how they're going to organize your mammogram, okay? So they're going to put right, left, this is called the medial lateral oblique view. And these are the standard views that you go in for when you have a routine mammo. And then this one is your cranial caudal view. And they will look at it and see how you can easily compare these side to side then. And so if there is any gross changes, it's much easier for them to look at. And then what they do is, if you've had prior mammograms, those are all lined up right with. Like, it is very systematic as far as how they read the mammogram. Oh, what the heck? What is that thing doing? Oh, hang on. That back one keeps turning on. Go away. So if something abnormal shows up on a mammogram and they find something and they tell us it's at 3 o'clock in the right breast, about 6 centimeters from the nipple, that means I have to go in and look for something and try to find something at that spot. It might be a little above, it might be a little bit lower than that, but the mammogram really tells us where something is. So when we look at this MLO view, this actually tells us above the nipple or below the nipple. The CC view tells us lateral or medial, and that's how we know where to go. Okay, so who may benefit from an ultrasound? Oh my goodness, that looks terrible.
Well, we can see it good.
You know how many hours? Oh well, right? Get the point across, that's what matters. Okay, so who may benefit from a breast ultrasound? Anybody wanting additional screening? If you have dense breast tissue, if you want a non-radiation option. Now, I will always say standard tool is mammogram. Mammogram is king. It's there for a reason, but I do know people don't want to have it. And so ultrasound is that next best option. Okay.
She's doing her head job.
So, and if you just have any areas of concern, And this will also give you a great peace of mind. If you're in between things, or if there's just certain things that you're just worried about, this is a way of getting or of having that peace of mind for you. And then if you just want a comfortable imaging option, like this breast ultrasound would be a great choice for you. Changes to watch for. New lumps. Now I'll explain a little bit how we feel lumps. So like if you feel something that's mobile and it's moving in your breast, those tend to be benign. Or this is a good way to test this out. Anybody have old dogs? I know we have a 15-year-old dog. Oh my gosh, she is full of lumps everywhere. And I can go, oh, a lipoma. Oh, this is like, I just can feel these things because of how they feel. Lipomas, they're soft and fatty and they move. A breast cancer isn't going to move. That thing is, because it's in the ducts, so that thing is not going to move. Oops. And then like dense breast tissue, that's one we do a ton of palpable lump ultrasounds for. Those tend to feel like bands in the breast. Now, the other thing that we would changes to watch for our breast pain. More common that we actually find something abnormal on would be if a patient has mastitis. Sometimes it gets to the point where it is so infected, there's like huge fluid collections, stuff like that. So if you are concerned and you have mastitis and stuff is not going away, make sure you get that looked at by your doctor. But I will be honest with you, breast pain is probably one of the most common reasons we do a breast ultrasound. And one of the common things we find absolutely nothing wrong, which is great. That is a good thing. Fortunately, it tends to be our hormones that are just messing with us and it makes us freak out, which it just does. Skin dimpling. That is a very strong indicator that there's a breast cancer that there's breast cancer in there. And typically that is somebody that is ignoring something going on. Those are very advanced because what it's doing is it's so bad in there that the breast cancer is literally pulling the tissue away from the surface. So it creates like an actual dimple in the breast tissue. Nipple discharge. I know I explained this a little bit before too, where nipple discharge can also be a sign that something is going on. It can be benign, it can be cancerous. So either way with those, it should be checked out. Swelling or changes in breast size. Again, that's kind of more toward like mastitis. We all know that when our weight fluctuates, that our breast size is going to change. That is what it is. That doesn't need to be looked at. If you have any areas that are persistently concerning to you, again, with our hormones, things change. They change every few months. So if it's coming and going, that's okay. It's where it's staying there and it's not going away. Redness or skin thickening. Those two, that can be anywhere from, sometimes we get these superficial like bumps that are red and swollen. And honestly, when we look at them on ultrasound, we're like, it does it. It looks like something else, but when we look at an ultrasound, that's what it ends up being. So those are common, but they can be indicative of something worse than that. That can be suspicious for cancer. Same thing with skin thickening too. Those are other very strong indicators of something else going on. And just really changes that feel different. So if you're concerned about something, let your doctor know, give me a call, whatever makes sense for you guys. But if something feels different or concerning, just make sure you don't ignore it. Okay. So what to expect during a screening ultrasound. So since my business is mobile, I can come to you, do it in your house, or you guys are welcome to come to Mina and do it in our house. Either way, you're in a very relaxed, comfortable setting. I do make it very interactive. I will explain as I go and use it as a way to educate you. If you come into me and you're telling me you're feeling a lump, I'm going to show you what it is on the machine and we're going to go over that. Okay. It normally takes about 15 to 30 minutes, just depends on what we're all looking at, how much stuff is going on in there. But if it's just a normal routine screening and we're not finding anything, it probably would take me 15 minutes or so to do. And then my images are interpreted by a board certified radiologist. And so you would get a report with those. I will say this, if you have a provider that would order an ultrasound for you, then that report would go to them. And if you need any follow-up care or anything like that, it's easier for you to go those next hoops. And this, of course, is going to depend on your provider. Versus if you have a report from my physician and you take it to your next ultrasound place or somewhere that you have an ultrasound, it's going to have more weight if it's coming from your provider. Okay. So if you guys can, I would recommend having a provider's order, but a lot of people don't want to even deal with that, and that's totally fine. So if that's okay with you, that works just as well too. And then I want to go back and okay, so there was one point on this that I forgot to explain to you guys. So when they look at something and they tell that so when you go in and you find that lesion or this lesion, what are the steps that the radiologist takes? So what they do, they look at this lesion and they go, okay, is there anything outside of 100% benign that we need to watch, or we need to go the next step on it? So 100% benign, we're not going to care about it, is this guy. This guy right here gets upgraded a little bit because he's solid. So that means when it's something like that, they typically are going to follow those every 6 months for the course of 2 years. If it has not changed at all, they're going to let it alone. And then it's going to be considered benign. But let's say 3 years down the road, you come in for a mammogram again and it's changed size, then we start the process over again. Now, of course, at any time, if you're a person that is like, I have to know what this is, I want to know, I want to have a biopsy, then by all means, have a biopsy. Nothing wrong with saying that and advocating for yourself. And they totally respect those kind of things. Okay. Now, if you come into ultrasound and have this one done, like at the prior place in Minot where I used to work at, we would schedule you for a biopsy before you left the office that day. And so you'd be prepared to know what's going on. So basically, if anything puts them outside of that benign, we're going to follow it in 6 months. If there's more than like 2 indicators that make them think this could be cancerous, they're going to just schedule you for a biopsy and recommend a biopsy. They're not going to mess with it unless it like very confidently looks benign. Okay. So just know with that, my point of that is there's a lot of stuff we biopsy, they're still benign. Just because you're having a biopsy doesn't mean it's going to be cancer. Okay. Because I know that's what we're all are freaked out about, myself included. I just went through all of this myself. I didn't have a biopsy, but I've been having stuff follow up and it's just been overlapping tissue. So it's been really good. But I wanted to make sure that I explained all that to you guys too, because that's kind of a big thing. Yeah. So I really appreciate doing this. What questions do you guys have for me?
I have a question.
Yes.
So I've had breast cancer.
Okay.
Do you do ultrasounds on people that have had mastectomies?
I can.
Okay.
Yeah, I can.
Because what's frustrating is in Montana anyway, they don't do breast exams after you've had it done. And I know several people that have had mastectomies and it's come back chest wall, it's come back,
Yep.
Different places.
Right.
And I'm like, we need to go talk to legislation about this because.
Are you having an MRI done or any other imaging?
No, they won't do anything. Yeah, so, yeah, nothing. I just asked, my last oncology appointment, other than if I need an exam done,
Right.
they'll do an exam, but no, they don't do MRIs, they don't do anything, which is.
And I'm assuming it's more than likely because of what cancer you have, the treatment you have.
Because I've had a double mastectomy.
Yeah.
If I just,
Yeah.
different,
Right.
but, unless I'm having symptoms
Yep.
or something like that. So, and I'm sure maybe if I, really pushed it,
Yes,
they would maybe order.
Yeah.
Just.
yeah. Yep. Yes, I can do that.
So yeah, I recognize all that stuff. It was crazy because the breast I had cancer in, or my non-cancer breast, I guess, I had calcification everywhere. Like it looked like 100 specks of sand. And I'm like, what is that all? So, yeah, it was kind of interesting.
So does this make quite a bit more sense now that after you've got?
I had worked in the medical field
Oh, you did?
for
Okay.
years.
So, well, yeah.
And honestly, when I got my mammogram, I didn't really look at it. And so when I went in, because it was the second time I had that biopsy, and I was like, foods, it's just fatty tumors
Yep.
again. And, but it was different because I had like 4 nurses in there and then the radiologist. And so they all knew already it's cancer. And I didn't even look at anything. So, yeah. Yeah, but better now.
Good. Any other questions? Well, if anybody is interested in having an ultrasound here today, we're thinking of, I might just go ask them if there's a spot I could do that at, or we're thinking of like lining up something and making a little corner, because I do have a massage table out in my car too, if anybody's interested. And I do have information. I, of course, haven't had time to put it out yet. I'll get some information out for you guys to take home too. Great. Well, thank you guys.
Thank you.
Yeah.
So,
200, 1 breast, 3.
okay.
And I can give you,
I'm like, what if you just have one spot?
that would be the 2.
Well, like, I mean, I said your results, I have this is all like swollen and they're like, I think it's just fluid, but. From my last surgery, because I've had 4 surgeries. So, yeah, just with that. Mercedes. I didn't even know she worked. I actually feel better today. Though.
Does it? Does it change?
Yeah, but it is kind of, I don't know if it's just a bunch of scar tissue because they have to take stimulus out there. She's just my roommate.
I am gonna go
So you have to run up the
Yes. If you open that.
Let's run back from you.
Me, well, when I went to the bathroom, please. So I went down to take care of it, and she, you guarantee your. But anyway, I have your girl. And it hurts.
Like vascular vacations. There's a lot of little fingers.
That.
Wanting.
Yeah. But I think graduation is the end too.
Isn't it? Campaign fair. I think it is in Alexander too. I just. My, Wilson State College graduated last, weekend. Yeah. Be nice with that. Like it's. So for this weekend, that, yeah, every, and more in the weekend, so. Very good.
And that's, I have a ton of experience, more than likely where you're getting it done, they're not. Serious. A lot of barriers there. Stage better is probably not.
Well, I feel like, he's right.
Then I have a giveaway for the name table. Okay.
Like, we're gonna look at it. We'd be that.
We've been giving away 4.
Tickets.
Good.
You know that.
changes. Well, which starts later than does, yeah.
Yeah, I mean, like. Brussels. Yeah, every age, we think it would be done at one point, in time, like, March, but, right.
Okay, yeah, well, I think it.
Yeah.
Ginger. Right.
Yeah.
Yeah. Well, my hair, tractor, doctors, or hair. So, we're guys, you don't have a care, nothing. Now, see, I'm not. Oh, yeah, it's all, it's very exotic. Very screw on there. Sure, you want to know, you right? So, yeah. Struck at the marriage. For years, I'm not gonna drink that yet. Well, I mean, you drink water. I mean, you drink soda and then I son like it. You're something like a usher juice, so. 3 years, 4 years ago. So I do, let's see, let's get up to the costs. I'm looking for them, they're all true. I put prop, I think 6 here, like that much is Jamie's, I need a little less of the prop stands here. It is a mother and go for a week without it, 2 nights, right? Even for the sheets in this past year, so it's.
Yeah.
So
I'm number 2.
Sure.
Yeah, okay.
So that, yeah, okay. What's in? Did your Christmas city? So what was that? Maybe. Oh, so you like if you money before. She's never done this.
And yeah, I think that was, no, yeah, then.